How do you know weight loss surgery is for you? Hi, my name is Josie, and the goal of my channel is to share information, be a source of support, and cultivate a community of adults contemplating weight loss surgery from the beginning of the journey through post-op. So how do you know weight loss surgery for you? Bariatric surgery, whether it's gastric sleeve, gastric bypass is right for you. First of all, know that it will be a team decision between you and your medical team. And the doctors will have some questions for you to answer and some things that they'll be looking at, but it's also really important for you to understand why it's important to you. It's really good to get an idea and be clear on your why for the surgery, because that will help you maintain your weight loss after surgery. I am currently 2 months pre-op approximately. I'll get surgery within probably 6 to 8 weeks from now. And it's a long journey. I've been in a program for 4 months now, and it's a 6-month program. So the first medical professional you will encounter to determine if this is within the realm of possibilities should be your primary care physician. If you're going to get involved in an ethical bariatric program, they're going to want to have your primary care physician's blessing. That's kind of like the first stop where you'll get a lot of clearances, and your primary care doctor will have some information. We'll have a pretty good idea if your history, what you're currently experiencing medically, and kind of your trajectory, if it's a good possibility for you. I started thinking about bariatric surgery right before my annual physical. I knew my appointment was coming up, and I was just doing some self-reflection and was thinking about all of the things that I had tried that didn't work, all the programs that I've been involved in, and I was hoping that maybe bariatric surgery, weight loss surgery, would be something that my doctor would think was a good idea. I was actually surprised when she did agree, pleasantly surprised. I was really nervous before the appointment, but first of all, thinking about why you think it might be a possibility. How is your weight affecting your health and your comfort? Are you mostly concerned about how others look at you, or kind of like how you feel in your skin when you're around other people? Is that your primary motivation? Is it painful for you to move in space in general? Are you dealing with lots of aches and pains? Are you dealing with some medical conditions that affect your health? Like maybe it affects your weight, and then your weight affects your health, like it's a vicious circle. Is that your situation? For me, I have 2 medical conditions that are impacted by my weight, and my weight impacts them. Wait, I don't know if I said that right, but they kind of affect each other. So I have sleep apnea, and I have very mild asthma, and then I have a circulation issue with my legs. So 2 of those issues, the sleep apnea and the circulation issue, it's like chronic venous insufficiency, those make me a good candidate for bariatric surgery. But those are complications I deal with, as well as arthritis in my feet and just the pain of trying to move in space with the extra weight on my body. I've tried a lot of things. I've tried Noom and Weight Watchers, V-Shred, low carb, exercise alone, lots of different things, and nothing was able to take a significant amount of weight off and help me keep it off. So after I met with my doctor and she kind of gave me her green light, her blessing, I went to a bariatric clinic, and in that clinic They take you in, they take all your vitals just like you do with a regular medical checkup. And then one of the first questions you'll be asked is, what have you tried before? Basically like, what have you failed at? And the clinic, as well as your insurance company, if you're lucky enough to have your insurance company help pay, will want documentation of that. So you'll need to like dig through and try to find documentation if you can. You'll have to do some blood work, and your health in general will be taken into consideration. So there's lots of different things that they look for, and I don't understand all of it, but I know that there are some health conditions that will make you a better candidate in terms of your health insurance. There are some medical conditions that work against you, where they might think that surgery is not a great option, or that you might be a medical risk while you're under anesthesia. And then there are some medical conditions that work like for and against you. And some things you might need to get under control. So for me, like for example, sleep apnea is something that makes me qualify for surgery. However, because I have sleep apnea, they want to make sure that I'm wearing my CPAP every night now before surgery, and then I'll actually have to bring that with me and put that on while I'm in recovery, because I am at greater risk of having complications after being intubated and being under anesthesia because I have sleep apnea. But it's also something that makes me qualify with a slightly lower BMI than what is typical for bariatric surgery. So sometimes you could ironically be too overweight to be able to get the surgery, and there have been cases of people needing to lose 100 pounds or more before their doctor feels safe doing surgery for them. So you will get a psychological evaluation. It will be really important to the team to understand your support network and who is rooting for you, who's going to help you through recovery, and how you're going to walk through life interacting with people in your environment after surgery. What is your lifestyle like? Where do you like to hang out? What do you like to do when you're with friends and with family? How do you typically eat with your family or your friends? Those are questions that are all important to understand the answer to. So I hope that this was helpful. If you are also going through the pre-op bariatric journey and you have any questions, leave them below. If you've been through it and you have anything to say about that, have any comments, leave those below, and I will be talking with you soon. Thanks.